Greetings everyone, hope you're having a great day. Today's little talk is on hyperbaric oxygen therapy. We'll talk about some of the basic concepts that one needs to master before not only embarking on this as a field of study but also as a field of practice. So the first question is, what is hyperbaric oxygen therapy? Well, it all says in the name. Hyper means high, baric means weight due to the atmosphere, and oxygen means we're dealing with oxygen. So hyperbaric oxygen therapy is breathing 100% oxygen at a pressure greater than the pressure exerted by Earth's atmosphere measured at the sea level. The pressure due to Earth's atmosphere measured at sea level is 1 atmosphere. So hyperbaric oxygen therapy is breathing 100% oxygen at a pressure greater than 1 atmosphere. So let's talk about pressure. Pressure is defined as force divided by area. Now, force, according to Newton's second law of motion, is mass times acceleration. One form of acceleration we are all familiar with on Earth is acceleration due to gravity, or G. So force equals to mg. But mg is equal to weight. So what does that mean? It means that pressure is weight divided by area. And when it pertains to atmospheric pressure, is pressure acting on a unit area of a body due to atmospheric gases. So let's do a little thought experiment. Imagine you're standing at a sea level, right? Sea level is the reference point for atmospheric pressure. And then from the top of your head to all the way to the top of the atmosphere, there extends a skyscraper made out of air. The foundation of the skyscraper is 1 square inch. So cross-sectional area is 1 square inch. But the height of the skyscraper is 36,000 feet. So it's a very tall and thin skyscraper made entirely out of air, gases. The weight of this skyscraper will be 14.7 pounds. And that is atmospheric pressure of 14.7 pounds acting on a square inch of your body, right? Now, atmospheric pressure has a reference point at sea level. Why? Because it will vary with elevation. Imagine you go on top of a mountain. If you go on top of a mountain, the height of this skyscraper will be reduced. So the weight of gases acting on your body will be lower. Equally, if you were to go down in a canyon below sea level, the height of the skyscraper will be increased and the weight of atmospheric gases acting on a unit area of one's body will increase. So the pressure increases. So atmospheric pressure varies with elevation. So in summary, atmospheric pressure due to weight of atmospheric gases, which is approximately 36,000 feet above sea level, is approximately 14.7 pounds per square inch. Some of the other terminologies that one should be familiar with is absolute pressure, which is sum of all the pressures acting on the body; ambient pressure, which is absolute pressure of gas or liquid surrounding an object; and lastly, partial pressure. Partial pressure is the pressure exerted by a gas in a mixture of gases which is proportional to its percentage composition of the gases. Okay, so let me give you an example. Oxygen is 21% of air. Atmospheric pressure is 14.7 pounds per square inch. So what is the partial pressure of oxygen? Well, it's 21% of 14.7 parts per square inch, and if you do the calculation, it's approximately 3 pounds per square inch. Pressure can be measured in various units. 1 atmosphere is equal to 14.7 parts per square inch, or equal to 760 millimeter of mercury pressure, or equal to 101.3 kilopascals, or equal to 33 feet of seawater. What does that mean, 33 feet of seawater? Well, it means if one were to dive into the ocean to a depth of 33 feet, the ambient pressure, the hydrostatic pressure an individual experiences at 33 feet of seawater is equal to 1 atmosphere, which is equal to the same pressure an individual experiences if they were walking on the seashore, but in this case the pressure is due to atmospheric gases. I also like to draw your attention to this graph. The vertical axis is the altitude above sea level, and the horizontal axis is the pressure. Notice at altitude of 0, which is at sea level, the pressure is 101.3 kilopascals. But if one goes up the mountain, i.e. the altitude increases to the point that if one climbed the Mount Everest, the atmospheric pressure at the top of Mount Everest is less than 1/3 of the pressure that an individual experiences if they were walking at the sea level. And as the elevation rises, the altitude rises, so does the pressure diminish. So to further cement our understanding of breathing at different pressures, let's talk about breathing at higher altitude. So briefly, partial pressure of a gas in a mixture of gases is proportional to its percent composition. So air is a mixture of gases. 21% of the air is oxygen and 78% of air is nitrogen. The pressure of air at sea level, or the atmospheric pressure, is 1 atmosphere or 760 millimeter mercury pressure. 21% of that pressure is due to oxygen, as shown calculated on the slide, and 78% of that total pressure is due to nitrogen. Now at a higher altitude, the concentration of oxygen is still 21%, which is similar to the concentration at sea level. However, the number of molecules of oxygen in a unit volume is reduced, i.e. the density of air is reduced, or the air is thinner, so thereby it becomes more difficult to breathe. Another reason why it may be more difficult to breathe at a higher altitude may be due to reduction in pressure gradients. Air flows along pressure gradients from a region of high pressure to a region of low pressure. So briefly, when we are breathing in or during the inspiratory phase, the diaphragm contracts. This contraction in diaphragm leads to increase in intrathoracic volume. This increase in intrathoracic volume leads to further reduction in intra-alveolar pressure and intrapleural pressure. So this further reduction in intra-alveolar pressure leads to greater pressure gradient between the outside air and the air inside the lungs or the alveoli, thereby allowing air to flow in from the outside or the atmosphere into the lungs. And the opposite happens during the expiratory phase, or when we breathe out. So if at a higher altitude air pressure is reduced, i.e. pressure gradient is reduced, one can imagine why it's more difficult to breathe. So let's return to the question at hand, which is hyperbaric oxygen therapy. Hyperbaric oxygen therapy is breathing 100% oxygen at a pressure greater than 1 atmosphere. It has to be greater than 1 atmosphere because breathing in 1 atmosphere is normobaric, i.e. breathing at normal pressure, because that's the pressure that we normally breathe at when we're breathing air. Now, before we kind of dwell into that, let's look at how oxygen is normally carried in blood. 98% of oxygen is carried by hemoglobin. 2% of oxygen is carried dissolved in plasma. Plasma is the fluid component of blood. So to give you an intuitive sense of that, let's say if one were to take a syringe and aspirate 100 mils of blood from somebody's femoral artery, recommend don't do it. Out of the 100 mils of blood, 19.3 mils will be oxygen. Out of the 19.3 mils, 19 mils will be carried by hemoglobin, and only 0.3 mils are carried dissolved in plasma. Okay, so a very large percentage of oxygen that circulates in the blood is carried by hemoglobin, i.e. about 98%. Now let me draw your attention to this graph. This is the hemoglobin oxygen dissociation curve. The horizontal axis is the partial pressure of oxygen in the alveoli, and the vertical axis is the saturation of hemoglobin with oxygen. As you can see, at a partial pressure of oxygen, which is around 100 millimeter mercury, which equates to the partial pressure of oxygen in the atmosphere, hemoglobin is about 97% saturated, right? That's breathing normal air. So when you're breathing normal air, 97% of hemoglobin is already saturated. So if you were to breathe 100% oxygen, right, at most the percent carried by hemoglobin can be only increased by 3%. So there are disease states in which we want to increase the amount or the quantity of oxygen circulating in the blood to deliver it to the tissues. So how can we do that? Well, we can't do it through hemoglobin, but perhaps there's another solution. By increasing the amount of dissolved oxygen. And how can we do that? Well, let's go back to basics. So as we have seen, even when breathing air, hemoglobin is near 97% saturated, i.e. near maximal saturation, and that's breathing air with oxygen at 21%. So if one breathes hyperbaric oxygen, at most you can increase the quantity of oxygen delivered by hemoglobin by a further 3%. So the question is, can we increase the quantity of oxygen dissolved in solution? And this is where Henry's law comes into play. Henry's law states that the concentration of a gas dissolved in solution is directly proportional to its partial pressure above the solution. So to give you an intuitive sense of that, when you open a bottle of pop, gas escapes under pressure, and that gas is carbon dioxide, because the fizziness of a soft drink is due to carbonic acid, which is due to increased quantity of carbon dioxide dissolved in solution. And to maintain that concentration of carbon dioxide in solution, one has to keep a certain partial pressure of carbon dioxide above the solution. Otherwise the soft drink becomes flat, or becomes rather distasteful. As we know, if one leaves a glass of Coke or Pepsi exposed to air, after some time the fizziness disappears or becomes substantially reduced. So when it comes to hyperbaric oxygen therapy, let me draw your attention to this equation here, which shows the amount of oxygen dissolved in solution is equal to the solubility coefficient of oxygen, which is 0.03 mils of oxygen per millimeter of mercury per deciliter of blood, multiplied by the partial pressure of oxygen. So greater the partial pressure of oxygen, the greater the amount of oxygen dissolved in solution. Now the next two slides are going to be a little laborious because we're going to do some calculations. However, bear with me, it will all be worth it, because we will see how through increasing partial pressure of oxygen there can be substantial increase in the amount of oxygen dissolved in solution. So first let's look at the amount of oxygen delivered to the tissues dissolved in plasma when breathing air. Now these figures are approximation. A normal adult human being requires about 250 mils of oxygen per minute. The oxygen solubility in plasma is 0.03 mils per millimeter mercury pressure per deciliter. The alveolar partial pressure of oxygen when breathing air is 100 millimeter mercury and not 160, due to greater quantity of water vapor and carbon dioxide in the lungs as compared to air. Therefore, per deciliter of blood when breathing air, the amount of oxygen dissolved is 0.03 times 100, which is the partial pressure of oxygen, is 0.3 mils. And since 1 liter is equal to 10 deciliters, so that's 3 mils per liter. And since an average human being has 5 liters of blood, that's 15 mils of oxygen dissolved in the entire quantity of plasma per human being. Now, since on average blood circulates around the body approximately 3 times a minute, so the maximal amount of oxygen that one could deliver dissolved in plasma to the body per minute will be 45 mils, and that's assuming perfect conditions, and practice is never perfect. So even assuming perfection, the amount of oxygen dissolved in plasma delivered to the tissues per minute is substantially less than that required to sustain life, and that's why we have hemoglobin. Through its unique characteristics, it's able to deliver increased quantity of oxygen to the tissues. Now, hemoglobin under normal circumstances is 97% saturated. So the question is, how does it deliver increased quantity of oxygen to the tissues during times of stress or exercise? Well, that's through increasing cardiac output. So when one exercises, heart rate increases, cardiac output increases. So instead of the blood circulating around the body 3 times a minute, it circulates faster. Thereby you can deliver greater quantity of oxygen to the tissues during times of stress as compared to rest, simply through increasing your cardiac output, even though the percent saturation of hemoglobin may still be around 97%, and the amount of oxygen dissolved in solution may not change at all. Okay? So by what factor does hyperoxygenation increase the amount of oxygen delivered to the tissues as compared to when breathing normal air? Let's explore this. Briefly, 1 atmosphere is equal to 760 millimeter mercury pressure. This is the oxygen solubility coefficient that we previously discussed. So when breathing 100% oxygen at 1 atmosphere or 760 millimeter mercury pressure, for a human being who has 5 liters of blood, the total quantity of dissolved oxygen is 0.03 times 760 times 10 times 5, which equates to an approximation of 114 mils. At 2 atmospheres is 228, and at 3 atmospheres is about 342 mils. So what does that tell us? It implies that theoretically, if one was breathing 100% oxygen at 3 atmospheres, sufficient quantity of oxygen dissolved in plasma could be delivered to the tissues at rest to meet the bodily needs without the need for hemoglobin, i.e. you can exist without blood. But to do that, theoretically, let me add, one has to be locked up in a chamber, doing nothing all day, breathing 100% oxygen at 3 atmospheres. Now, some people may find that interesting. For me, that'll be rather boring and claustrophobic. Now, how does that compare to the multiples of oxygen delivery when compared to breathing normal air? Calculations show it's about 15-fold. Now, I did these calculations from first principles because I wanted to illustrate a point. There's an easier way to do these calculations, and here it is. So you're looking at the effect of breathing 100% oxygen at different atmospheres. So it's 100% divided by 21% because you are looking at relative to air, which is 21% oxygen, times 3. In this case, we're looking at breathing 100% oxygen at 3 atmospheres. So the amount of oxygen delivery is almost 15-fold greater as compared to when breathing air. Now the number varies between 14 to 15 depending on whether you use oxygen concentration in air as 21% or 20%, but you get the idea. So at 2 atmospheres is 100 divided by 21 times 2. At 1.3 atmospheres is 100 divided by 21 times 1.3, and you can calculate the multiples of oxygen delivery under these circumstances as compared to when breathing normal air. Now, what is the experimental evidence for all this? Okay, now that's what we are going to look at next. So all good in theory. Question is, where's the experimental evidence? Here is a partial copy of the paper published by Professor Borima from the University of Amsterdam in the Journal of Cardiovascular Surgery in 1959. In 1940s and 50s, they conducted a series of experiments which I'll talk about in a minute. Before I do that, let me very briefly talk about volume expanders. If an individual is bleeding and blood is not available, doctors will commonly use volume expanders, which include albumin, dextran, or plasma. So, Professor Borima and colleagues conducted a series of experiments whereby they washed out the blood from the pig's body through aspirating it through the femoral artery and used a comparable amount of volume expander, which was either plasma or macrodex, infused through the femoral vein to maintain the pig's blood pressure to a point where they managed to wash out over 95% of the blood. So normal hemoglobin is about 12 to 16 grams per deciliter. They managed to bring it down to 0.4 to 0.6, which is 20 times less than normal, and replace it with a volume expander. Now pigs were able to survive when over 95% of the hemoglobin was washed out. Well, how did they do that? Well, pigs were in a chamber breathing 100% oxygen at 3 atmospheres. And subsequently, the pigs were revived, i.e. Blood was reinfused and the volume expander was extracted, and the pigs made uneventful recovery without any EKG changes or any neurological deficits. So these experiments are commensurate with our earlier discussion that one can deliver sufficient quantity of oxygen to the tissues through hyperoxygenation by dissolving it in plasma. Now, when we are using hyperoxygenation, aim is not to substitute for the function of hemoglobin, but rather to provide a complementary function, i.e. to deliver supraphysiological levels of oxygen which are needed in certain disease states. And we will discuss in subsequent lectures or other talks how high levels of oxygen are beneficial in different disease states and under different pathological conditions. So this is a paper titled "Life Without Blood, available online, which you can look it up. One of the seminal papers in the field of hyperbaric medicine. So seminal work in the field of hyperoxygenation has shown that pigs under laboratory conditions, when breathing 100% oxygen at a pressure of 3 atmospheres, even when over 95% of their blood or hemoglobin has been washed out and replaced with plasma or tissue expanders, are able to survive without any cardiovascular or neurological deficits. Second, even though one is able to deliver increased load of oxygen to the lungs, i.e. to the alveolus, is there a commensurate increase in the arterial oxygen tension, i.e. do the physiological conditions allow for dissolved oxygen in the plasma to increase, or is it just a theoretical exercise? So let me draw your attention to this experimental data. Here is animal breathing air at 1 atmosphere, which is normal pressure. The arterial oxygen tension is about 90, 89, 90. When breathing pure oxygen at same pressure, it increases to about 500, a rise by a factor of over 5. When breathing pure oxygen at 3 atmospheres, it increases to over 1700, a rise by a factor of over 17. So these experimental data validate our theoretical calculations that when an individual is breathing pure oxygen at elevated pressures, anywhere from 1 plus to 3 atmospheres, there's a commensurate increase in the amount of oxygen that is delivered by the cardiovascular system to the tissues. Now, the golden question is, even if you can deliver large load of oxygen to the tissues by dissolving it in plasma, is it being extracted or does it just circulate back to the lungs? Right? It's totally a waste of time if it just circulates back to the lungs, right? So let's look at venous oxygen tensions. So when breathing air at 1 atmosphere, arterial oxygen tension falls from about 90 to about 41 in the venous system. So a drop off by over 50%. When breathing pure oxygen at 1 atmosphere, it goes from 500 to about 57. A reduction by a factor of 8, 8-fold decrease. And when breathing 100% oxygen at 3 atmospheres, it goes from 1700 to about 424. So yes, a substantial quantity of oxygen is extracted by the tissues under hyperbaric conditions, i.e. oxygen diffuses from the capillaries into the interstitial fluid and into the cells. So these experimental data validate our theoretical arguments we made earlier, and that's good. So this was a basic introduction to some of the concepts that one should be familiar with before using hyperoxygenation as an adjunctive therapy to medical or surgical means to treat a diseased state. And in subsequent talks we'll elaborate on this further. As I said, this was a basic introduction. Let me illustrate this further. Earlier on I made a statement that atmospheric pressure is essentially weight of atmospheric gases acting on an individual's body per unit area. Well, we all know from elementary physics that pressure of a gas is directly related to its temperature, because greater the temperature, greater the kinetic energy of the molecules, so greater the force that they will impart on the walls of the container. And atmospheric gases are not just sitting there as dead weight. They have kinetic energy. So this equation here allows one to make more precise calculations. This is pressure at height h is equal to pressure at height 0, which is sea level, multiplied by natural log to the power of mgh over kt. So it takes into account the weight and also temperature of atmospheric gases. But it does not take into account humidity, because atmospheric pressure is also affected by humidity. So my point is this: depending on your field of study and practice, you can refine the measurements further and make them more precise. So I hope you enjoyed this brief introduction, and feel free to elaborate on some of the concepts we discussed here. If you like this video, please subscribe to the channel and like the video. It helps out the YouTube algorithm. Making these videos is time consuming, so it does help out the channel as well. Have a great day, have a great week, and talk to you soon. Bye for now.